we're here obviously to talk about migraine care in light of the COVID pandemic. So I guess sort of to just get right into it, we can kind of start with, your personal experience. What's sort of been, how has your personal experience with patients or in research or whatever you might be doing, how's that sort of been impacted by this pandemic?
Well, as with everybody else in the country, this has been an abrupt change and a very significant change in the way we help our patients. Specifically, all of our outpatient visits have essentially been canceled. This includes both evaluation and management visits as well as procedural visits. This means that many patients who are dependent upon procedures which occur on a scheduled or recurrent basis can't get them. So we've had to make a huge adjustment, moving to telemedicine for visits, either by Zoom or Skype or FaceTiming or even just telephones, to re-engage with our patients and see whether or not we can make changes to their regimen, which will keep them away from emergency departments and actually keep them with the appropriate physical distancing, which has been appropriate and mandated right now. So for me, not in any way an unusual circumstance, I've been really sequestered at home, taking care of telemedicine visits pretty much continuously, and awaiting, as is true for probably most neurologists and doctors, whether or not I'll be needed to take part in surge deployment, as they call it. I'm in the doctor resource pool for my medical center and region, and they're expecting, obviously, the surge in patients, acute patients, to occur sometime over the next several weeks. And, this is a time where I might be deployed for that, which means that whatever telemedicine appointments that have been set up during that time would have to be further postponed. Yeah. So everybody has had to make a lot of adjustments. The good news is that, at least within our medical center, they've done an extraordinarily good job in getting this together. And I think that we're pretty close to up to speed at adopting these new telemedicine procedures for interacting with our patients. And our patients, and I would like to think that this is something about the wonderful people in the region I live in Vermont, but people are very understanding about this and very eager to make whatever adjustments are necessary to ensure that they're safe and they can still receive whatever care we can provide remotely. It is challenging. There are things we can't do, not just in terms of the procedures that we can't provide, but in particular, that we can't examine patients. And this is a huge issue in headache medicine, particularly on initial evaluation. When I see a new patient, patients usually come referred because they have a recurrent and severe headache problem, headache disorder. And it's very, very common for patients to be highly anxious that this is something other than migraine. The good news, of course, is that migraine is so prevalent that it rarely is a secondary cause for the headache, but that doesn't change whether or not patients are going to be anxious about it. And I'm unable to provide the kind of usual reassurance that I can provide, showing that their examination is normal, send them, if necessary, for diagnostic tests or labs to exclude other possible causes. So to some extent, it's actually a bit of a quandary with respect to how to manage new patient appointments without really enhancing the anxiety that patients already have, based upon the fact that we are in an anxious time. 7 billion humans with anxiety at the same time is kind of unusual. Plus the fact that people with migraine have a higher prevalence of anxiety to begin with. So there are certain peculiarities or particulars about helping people in this particular therapeutic area right now that we really have to contend with. It is an issue where we deal with it on a case-to-case basis. So there's no hard and fast algorithm about it, but it's not as easy as maybe some people might think.